All right, so here we are going to discuss some specific structures found within joints, starting with tendons versus ligaments. Now, we will be asking this question on the exam. So, what is the difference? They're both fibrous connective tissues. They're both going to connect things. Tendons, however, are going to attach our muscles to our bones. They're going to also potentially attached to structures such as the eyeball. So the eye muscles attach to both the eyeball and the bone. So basically, they're going to attach to whatever they're going to move or whatever they're going to anchor to, because that is what they're going to do. When the muscle contracts, that tendon is going to pull on whatever it's attached to, causing it to move if there's enough of a contraction. Ligaments, on the other hand, still fibrous connective tissues. They're going to connect bone to bone and usually serve to hold them together and keep them stable, as we mentioned in the different types of joints. So here we have a biceps tendon. It attaches up here to the humerus and then down here to the radius. Here we have ligaments connecting the various phalangeal bones. We have ligaments connecting joint spaces at the very bottom of the metaphalangeal and the phalangeal bones so that they don't spread too far. It's what helps make sure our fingers can stay relatively attached to each other. We also have a bajillion autocorrect on my phone earlier. It almost had me saying the wrong word. A bajillion ligaments found connecting all of the carpal bones, because there are 8 of them, to each other. Also connecting them to the radius and the ulna, and the radius and the ulna together, connecting those same carpal bones to the metaphalangeal bones. So we have the palm of our hand, lots and lots and lots of ligaments, helping to maintain a stable, supportive structure so they don't wander away from each other. Very important to know the differences. Articular cartilage is going to be found at the ends of bones in synovial joints, and they're going to do 2 things. One, they're going to help the ends of the bone glide over each other nice and smooth. Think of them almost like the felt pads that you put on the bottom of like chairs or table legs so that they glide smoothly over a wooden floor. That's what articular cartilage is. The other thing it's going to do is, in a very minor capacity, work to act as a cushion. So if the 2 bones happen to get knocked together, they don't bang themselves up. Okay, but that being said, there are other structures that are going to work to cushion things. For instance, the knee and the hip are going to have what are called menisci. Menisci are cushions of cartilage, and they're nice and fatty and help prevent them from knocking into each other. We're also going to have bursa, which are, think of bursa as little jelly fluid-filled sacs. They're going to be found underneath, usually tendons, sometimes muscles, sometimes ligaments, but their main goal is to keep them off of the bone so that the muscle, the tendon, or the ligament can glide smoothly over the bone to help prevent them from getting caught or creating excessive friction. So again, these bursa are like those little felt pads. We have discs of fibrocartilage, which are also going to work to prevent the bones from knocking into each other, but also allow for smooth gliding. Between our vertebrae, we are going to have intervertebral discs. They look like this down here. This is spinal cord. This is the vertebral spinous process. nerve roots coming out, and here's our intervertebral disc. So the intervertebral disc has a very fibrous, it's actually called annulus fibrosus of the disc. It's very fibrous wrapping around it that runs in all directions. So one wrapping might run counterclockwise, the next one might run clockwise, one might run up and down, one might run completely side to side. And the reason they alternate directions like that is to maintain strength and integrity no matter what direction the force is coming from. Very tough, very fibrous. Inside of that is going to be found the nucleus pulposus of the disc, and that is very much so a jelly fluid-like inner center, which is very squishy and allows for some slight compression of the disc if you're, say, jumping up and down or you meet some sort of force. It gives a little bit of giving so you don't damage or are less likely to damage nerves and bone. However, it can only absorb so much. So there are limitations. All right, that is the end of that particular audio. The next one is going to go over the knee itself.